Pit and fissure sealants. We have been doing a series of videos on different types of dental fillings. What are those, where they are required, what is the cost of it. In this specific video, we are going to look what sealants are, where they are used, how we go about doing it, what is the cost of the sealants. So typically when you look at our tooth is not flat. There is a lot of elevations and depressions in the tooth. The reason for these elevations and depressions, that's how our tooth is formed. They don't form as one part. Multiple parts form and then fuse together to get the tooth, to get the final tooth form. So when the final tooth form, there are elevations and depressions, like the mountains and valleys are there. That's how the tooth is structured. So in those depressions, typically food can get caught. When food gets caught, chances of decay is very high, especially when our maintenance is low, or sometimes our decay incidence in the mouth can be very high. So at that time, when we typically look at our patients, we suggest what are called pit and fissure sealants to them. So in that sealants, typically what happens is, when we do a sealant, we don't do any grind the tooth structure, we don't remove any tooth structure there. So there is an existing tooth structure. On the depressions of those tooth structure, there is evidence that there can be a chance of a future decay there. When there is evidence that there is chance of a future decay, we do what are called pit and fissure sealants. Now in the next part of the video, we will be looking at how we go about doing that. This is Dr. Arun from Pearls Dentistry, running a dental center since the year 2001 at Chennai, Raja and Amlapuram. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of video coming out in the next 1 year. Now let's look at how the sealant is actually being done. If you look at the tooth now, the tooth has got a lot of these are the elevations in the tooth, and there are something called the depressions. So in these only there are what are called pits and fissures. So this is actually a model of the tooth. This is not the actual tooth structure. We are only seeing the model of the tooth. Now when we have a patient with, like, say there is a filling here, and there can be, you can see this small black spot here, right? So when we see such spots, it means that the chances of this tooth getting decayed is very high. Typically when we see our patients between 6 to 12 years, it's called the mixed dentition stage, where those permanent teeth are erupting, we do this. Or for adults, when they have all fully erupted teeth but they have got some root canals done, some tooth extractions done, some fillings done, then we do those sealants. So how we go about sealants, it's very important to know that for doing a sealant, we don't grind any of the tooth structure. First we do a cleanup. We clean all the surface debris that is there from the tooth structure. Once we clean the surface debris, we apply what's called an etchant. So etchant is typically blue in color. You can see me applying the etchant on the tooth structure. Now once the etchant is applied, we wait for the etchant to act. The etchant, typically what it does is it creates small micro porosity on the tooth structure. Once the etchant is there, we wash the tooth structure of the etchant. You can see me actually washing the tooth structure of the etchant. The tooth structure becomes completely clean. So once we wash it, we actually dry the tooth structure. Once it's dried, then we apply on the etched tooth surface, we apply what is called a sealant. The sealant are basically a thin flowable material. You can see me applying the sealant. It's typically, it comes in various colors. This particular sealant, what I'm using, is pink in color. Because it's a thin material, it flows and then goes into all those depressions on the tooth structure, all those valleys, right, where the decay can actually start, and then fills those areas. Then what we do, we apply what is called a light cure and then cure it. So once a light cure is applied, you can see the actually sealant becomes tooth colored or white in color. You can't identify, the pink is not seen anymore, it has become white in color. So now this, what it does is, this goes and protects the tooth structure completely, preventing the tooth structure from getting any decay in future. So that's what this does. So because of wear and tear, the sealant might get worn off over a period of time, might require some changes, but the advantage is we are not preparing the tooth structure, there is no grinding of tooth structure involved. So you saw how the process of sealant is being done. The cost of the sealant can, depending upon the age of the patient, the material we use, the number of teeth we do, what is the condition in which tooth we do, can vary anywhere from 1,200 rupees to approximately 2,000 rupees. So that will be the cost of it. The main benefit it protects the teeth from future decay. It prevents tooth decay from happening because the released fluoride, it makes the teeth more resistant to decay. Next main benefit is we don't have to grind the tooth structure. So it's a very simple, effective way to protect the teeth to prevent future tooth decay. I hope you like the video, and if there are any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun signing off from Pearls Dentistry. Bye bye and thank you.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.